Medicare premiums are on the rise. The Centers for Medicare and Medicaid Services announced the monthly Medicare Part A and B premiums for 2024, with costs set to go up by 6% next year. The premiums would increase by $9.80 from $164.90 to $174.70 in 2024, and the annual deductible for Medicare Part B beneficiaries will go up from $226 to $240 as well. This price increase comes after Medicare Part B premiums went down for the first time in more than 10 years in 2023.
CMS said on Thursday, quote, the increase in the 2024 Part B standard premium and deductible is mainly due to projected increases in health care spending and, to a lesser degree, the remedy for the $340 billion acquired drug payment policy for the 2018-2022 period under the hospital outpatient prospective payment system. Jess, I got to tell you something. I mean, we're looking at a 6% increase in 2024 from this year in the midst of inflation. That's a lot of money for the average American. And there's this fascinating study that came out from Physicians for National Health Programs that I was just looking over that showcases Medicare Advantage overbills taxpayers by $140 billion a year, Jess, which is enough to completely wipe out Medicare premiums, according to this new report.
Yeah, the amount of waste in our healthcare system in the United States is insane. The amount of money that we are overpaying for drugs and care, when we compare another country that spends less than healthcare than the United States, we find that they have better healthcare outcomes. And that's simply because we know that hospitals in the United States that run for profit are overcharging. We know that insurance companies are treating the insurance industry as a profit-driven one. Health care is not the priority. They're not being honest in their practices. They're denying people necessary care, even when you have coverage and you're paying that high premium. Sometimes your insurance will come back to you and say, actually, we're not going to cover this service at all, even though it's in your plan that we will cover it because we've deemed it unnecessary. That's a decision that should be between a patient and a doctor, not an insurance company. And when we think about other countries that have universal health care, the common question is, well, doesn't that mean the quality of care will go down? Clearly not. They have better health outcomes than us. We hear the common statement that they're waiting in lines to receive care. When I call for an appointment with a specialist, I have to schedule it at least a month out. We are waiting in line. We're just not present in the office when we're doing so in the United States. So we've got to change how we do healthcare in the U.S. altogether. If the United States had universal healthcare, they could collectively bargain for better pricing instead of having the entire American people taken advantage of by corporations that want to treat healthcare like it's an industry that they can come in and just make money off of and not really care about health outcomes for the American people.
Now, look, I think you're absolutely right. I want to read a quote here from this article that I referenced at the top. A quote, "This is unconscionable, unsustainable, and in our current healthcare system, unremarkable," according to the new report. It goes on to write, "Medicare Advantage is just another example of the endless greed of the insurance industry poisoning American health care, siphoning money from vulnerable patients while delaying and denying necessary and often life-saving treatment." To your point of having to make an appointment weeks in advance. I mean, look, I think for the average person right now, people just want decent, affordable care. And I have sort of tried to figure out if it's possible to sort of have a private sector option for those who want to pay for private care, and also having some type of a government-backed option for people who need that. I mean, healthcare is incredibly expensive. I'll give you an example. My mom right now is going through some cancer treatment, and granted, they have a private care, my parents that is, but it has taken so long, Jess, for just some of the most basic things as it pertains to her treatment, that she's considered going to a whole different state to try to see if the treatment could be expedited, because one of the processes that she has to take, I think she can't essentially get it until the end of November. And so when her and I were talking a couple of days ago, she said, who knows what could happen to me in the next 30 plus days by having to wait for this next stage of my treatment to the end of November. And when she asked the physician, well, why is this taking so long? The doctor just said, well, this is just the way it works.
Yeah, I think anyone who tries to frame this increased cost in premiums as something that is affordable $9 is a meal for many people. Many
Yeah.
people are struggling to make ends meet as it is. People are living month to month, if not paycheck to paycheck in the United States more than ever now. And you have our elected officials, Speaker McCarthy, the Republican caucus, and even many Democrats sounding the alarms, saying that Medicare and Social Security are programs that are going to become insolvent. When we talk about the defense budget and the amount of money we are spending on U.S. defense, which typically means we're on the offensive somewhere, it's money that doesn't just go into defense, it funds the entire military. When we run out of money, or the Pentagon runs out of money rather, simply the account is credited. That's all that happens. Congress votes to authorize more defense spending, and the account is given the necessary dollars. Someone simply presses a button in the federal government, in the Treasury of the Federal Reserve. So when we talk about what is going on with spending, we need to put this in context. Are we running out of money in the Medicare and Social Security programs? Are those accounts running out of money, or are elected officials just simply deciding not to spend public dollars on healthcare and retirement? So this framing that the U.S. government is running out of money and we're going to need to do something about programs that are insolvent, why don't we talk about it like that when it's the Department of Defense and the Pentagon wants more money to spend on weapons? And it's a deliberate choice, I think, by our elected officials in Congress.
Well, look, I do think national defense and security is an important issue for most Americans. I think people would agree with that. But I also think people want to be able to have access to affordable care. I mean, it's costing seniors $165 coming out of their monthly Social Security checks to pay for this increase in premium. We already know that there is clearly not enough money to go around. We're in the midst of inflation, so everything's it's just naturally more expensive. It is what it is. And so despite some of the statements from the Democrats that the economy is getting better, I think for the average person, to your point of $9 being a substantial amount monthly, that's going to make a difference whether the inflationary numbers look better or not. And I think that has to be a part of the consideration. But again, I go back to this idea that the government's being overtaxed by $140 billion that could wipe out all Medicare premiums. Now think about that, Jess. We know that you could essentially wipe out Medicare premiums altogether if the government were to say, wait a minute, why do you continue to overbill us, which is now being passed on to the average American person, instead of saying, wait a minute here, we have to solve this problem for everyday people who are struggling to afford for medical care, particularly those who have ailing parents or may have some type of a health issue themselves. And we're not seeing that come from our political leaders, and I think we need to.
Yeah, I think our political leaders deciding to fund public spending through the issuance of treasury bonds, where when the interest rates go up, and they claim interest rates going up is going to resolve inflation because of the effects on the economy, less people will take out loans, start businesses, there will be less jobs. People won't be able to work. But when you're issuing treasury bonds at a 5% interest rate over 5 and 10 years, you're going to disrupt the economy because now you're injecting a bunch of money into the hands of the wealthiest people. You are still increasing the amount of dollars in circulation. Do you want those dollars to go towards protecting our seniors, giving them health care? Or do you want those additional dollars that you're adding into the economy to go into the pockets of the wealthiest people? It's a very simple question. And we don't have Jerome Powell being questioned on the floor of Congress. We don't have Janet Yellen being questioned on the floor of Congress asking, why are we doing things this way? And it's time we start asking that question. Why are we making decisions in this manner, where when we could instead be increasing the productive capacity of our economy by having a healthy population and spending public dollars on guaranteeing healthcare and paying for those premiums? Why are we instead just giving the money to the wealthiest people? Why do we have a tax on the working class with the promise that it will one day bring down inflation when the numbers show it's not, and it's not quelling job growth in the economy either? I think that's a question that we need Janet Yellen to answer, we need Jerome Powell to answer, we need Speaker McCarthy to answer, we need Matt Gaetz to answer, and we need Bernie Sanders, the chair of the Budget Committee, to answer as well.
Jess, you're listing everybody. Somebody with an answer, please stand up, right? I mean, look, I go back, I'll say this quickly, to the National Health Program. We know why premiums have increased, and we also know what it's going to take to essentially wipe them out. We know that overpricing the government, overpricing the American taxpayer is a part of the problem. Jess, I think individuals that you just named don't worry about this stuff because their health care is free or they can afford it. So why worry about the 90% of Americans who are struggling to take care of themselves when it's not their problem? More Rising after this.